Hi, I'm Dr. Mustafa. I'm a consultant psychiatrist and I'm the Associate Medical Director for the Trust.
I'm Susanna Meakin. I'm an approved mental health professional and the social care lead for the Trust.
Section 2 is part of the Mental Health Act. It's part of the law and legislation that allow professionals in the NHS to care for people. Under Section 2 of the Mental Health Act, the medical and clinical profession have the ability to detain people in hospital when they are so unwell for the purpose of assessing and possibly treating their severe mental illness. Section 2 is part of the Mental Health Act, which overall should be providing the best and the most compassionate care to the patient. Section 2 is specifically designed for people who we suspect that they have a mental illness. We want to confirm whether they have a severe enduring mental illness, and that assessment can only happen in a hospital setting. The purpose of Section 2 is to ask the patient to step into one of the designated inpatient units on a formal assessment to determine whether they have a severe enduring mental illness and what is the best possible care plan and options for treatment.
The criteria for Section 2 is that the person is potentially suffering from a mental disorder of a nature and degree which warrants their detention in hospital, and that provides a period for that assessment to take place, and it's in the interest of the person's own health and safety or the protection of other people.
When people are so unwell, suffering from a severe form of mental illness, or as the public say, a severe breakdown, sometimes they are so unwell, so they would not be able to accept the need to become in hospital, to go into hospital. So what we do is that we use the power of the law to care for them more, within a very comprehensive legal framework, to ask them to step on our wards, to enable us to assess them, to identify what's wrong with their illness, and to help them to recover as soon as possible. To do that, we have to ask them to come into the hospital under a framework of law, which is Section 2.
The approved mental health professional, or the AMP, is the applicant in a Section 2 under the Mental Health Act. But in order to be an applicant, you need to ensure you have medical recommendations, which also say that the person needs to be admitted into hospital for assessment and or possibly treatment for the mental disorder. The medical recommendations, one must be from a responsible clinician, an experienced trained doctor who's approved, and also one should be by a doctor who has what we call previous acquaintance. Wherever possible, that should be the person's own general practitioner. If the GP is not available, we then may have to go to an independent doctor list, what's called a Section 12 approved doctor list, which are people who've had specialist training in mental disorder and in the Mental Health Act, but they mustn't be in a supervisory relationship with the responsible clinician that you're using.
Within the law, there is a requirement to have a responsible clinician, or in short, an RC. The responsible clinician is a senior clinician. He is usually a doctor, but also other senior clinical professions, so he can be a social worker or a nurse, who takes the overall responsibility of the clinical requirements of the patient while he's on a section. So he will be responsible on assessing the patient. He will be responsible on identifying the need for the patient, and part of his ethical and legal duty that at any point, if the patient doesn't need to stay on the section, he can terminate the section immediately. And that is usually the case in most of the Section 2s that we do. When the responsible authority receives an application to assess someone under the Mental Health Act, 2 qualified clinicians have to support this request by a formal recommendation. It's a legal document So once it's signed, it becomes as legal as a paper note. Within it, there has to be a clear, explicit information why this patient is being assessed, what are the reasons that we suspect that he has a severe enduring mental illness, and specifically what are the reasons why we cannot treat him in the community. It also has a clear and explicit recommendation about the patient's rights and how they will be reserved. So the application, for instance, is not only signed by doctors or by clinicians, they go to appropriate authorities who are independent, and they would confirm or disagree whether this recommendation is the most appropriate and in the best interest that we can provide for the patient.
Along with the application and the 2 medical recommendations, the nearest relative must be informed wherever possible that an application is going to be made, and also of their rights to bar the application if possible by applying to the hospital managers or applying to a mental health review tribunal.
Section 2 should end up as soon as possible once that assessment has been finalized. So the aim of the length section of Section 2 is to be finalized as soon as possible. However, we think that of a realistic expectation, the law has determined that Section 2 can extend up to 28 days. The law requires that at the end of the 28 days, the recommendation should done either to continue the treatment under other Mental Health Act section, or the section elapses. Usually in the vast majority of our sections, they end way before 28 days.
All service users admitted under Section 2 have access to an independent mental health advocate and also can appeal to a mental health review tribunal and a hospital manager's appeal. That means they can ask for their detention to be reviewed as to whether the criteria for the ongoing detention in hospital is met. They can appeal immediately on arrival in hospital, and the appeal will be heard within days of their arrival.
In the vast majority of Section 2, it is discharged by the clinician, by the responsible clinician, either in 2 ways. Either that the assessing team has determined that the patient suffers from severe enduring mental illness and it's in his best interest to convert him to one of the treating sections, or that the patient does not have a severe enduring mental illness and he's then discharged by the responsible clinician, which is a very rapid and speedy process. On occasions, the patient, through the legal framework, a mental health tribunal would assess the need of a section and determine that that section is not necessary, and in that case he can be discharged through a tribunal.
So a recent example of a Section 2 was the man we saw the other week, who the doctor, the GP, rang us after he'd been in surgery, quite concerned about him because although he's been known to us to mental health services for a long while, he was presenting quite differently in the surgery. We went out on a joint visit, didn't we? And we were quite concerned about how his mental state had changed. It presented very differently from usual. But also he was not, we thought he couldn't really be cared for in the community. He was quite upset about us seeing him. So we did think he needed to come into hospital at that point. And he wasn't willing to come in informally. So you provided a medical recommendation.
Yeah. Although the patient is known to us and he has a long-standing history of severe enduring mental illness, on that particular incident he did not present in the usual symptoms, in the usual way that he would present to us when he's unwell. We thought that in his best interest we should not consider what he has presented with as a continuum of his own or old illness. We should have a fresh way of looking at it, and whether we are looking to a new or a different type of illness. We agreed that the best framework was to do a Section 2, which is an assessment section, based on our previous knowledge, based on the patient's presentation, The GP was very helpful and agreed that that would be the best course of action, and it provided the patient with the ultimate legal protection as well. Unfortunately, the patient was not agreeable to come into hospital because we have both ethical and legal responsibility to offer him all best options. So we had to convey him under Section 2.